We are going to be speaking about ovum donation and surrogacy. We have an excellent panel of expert speakers, and I'm actually going to talk a little bit about the parallels between the psychological evaluation and the legal contracts. There's a lot of overlap, and we work really well together to make sure that people are really clear about what they're getting into. This is really the purpose of the psychological evaluation, especially when there's a known donor or a known surrogate, that it's really, really important that everybody is clear about what each other's expectations are. And so that's the purpose, and it's important to have that determined before the procedures are done. So that's what we do when we do the evaluations. We talk about the same things and ask the questions that you go over in your contract, Susan, as far as embryo disposition, the fees involved, what kind of future contact, what are the expectations, especially in a known donor situation. What are the expectations as far as contact? We always want to make sure that the donor, we ask them, are they going to be involved, or do they want to be involved in the raising or the parenting of the child? That's a really key question. And with every donor that we've evaluated, they're very clear that they really don't, that they really have the sense that they're donating genetic material. But sometimes we do have donors that feel very strongly about the disposition of the embryos, the additional embryos. And so that's important to have that gone over and make sure that everybody's in agreement. And of course, the confidentiality piece, talking about issues of disclosure, which is a very, very important part of the process, the ovum donation process, especially. uh, we talk about, or what I like to say is, who you tell, what you tell, and when you tell. And so this is a big topic of conversation. And it really, we find a lot of times in the psychological evaluation that there's an education piece, and there are several really, really good books that we recommend when people are uncertain or unknown about how they're going to disclose or how to do it, that I want to bring up. Um, the number one book is Mommy, Did I Grow in Your Tummy by Dr. Gordon. That book has been around for a while, and it's really an excellent explanation for a child as far as the process in which they were conceived. And then Mommy, Was Your Tummy Big is real cute by Carolyn Nadell. It has an elephant on it. And then Lisa Bergren wrote God Found Us You. So that has a little bit more of a spiritual bent to it. So these are books that we suggest in the psychological evaluation. And also, too, when I have individuals or couples come to me that are transitioning to, or considering the transition to ovum donation, they have a lot of common concerns. And the number one concern is their sense of grief and loss. It's just wrapping their mind around the concept that they are, if they go in the direction of ovum donation, that they are not, the woman is not going to be contributing her genetic material. And this is really a tremendous loss, because we all have our conception and our birth fantasies. And usually, when we're thinking about conceiving, we think about all the wonderful traits that we're going to pass on to that child. I hope that they have my hair. I hope that they have my you know, sense of humor, whatever those traits are. And so when it's a situation where ovum donation is considered, that is not going to be happening for the woman. So that there's the sense of grief and loss. It's interesting. We always think about our that our children are going to have all of our wonderful traits. But the reality is that they get a mixture of our positive and negative traits. And so that's something that I usually explore with the intended parent, is that particular piece. But there is a grief and loss process that we talk about. Um, The other issue that comes up is donor selection. How is the donor going to be selected? And a lot of times this is a couples issue. And I know that we've joked. I actually have had groups that are exclusively ovum donation groups that have been amazing. And in the group, we were joking about, the women were sharing about how their husband really was drawn to the tall blonde woman that looked kind of like a bimbo. We called it the bimbo syndrome, and how they were laughing about that and just talking about then that there were certain qualities and traits, physical traits, that they both would agree on. Um, and so that's part of the process too. And the one of the concerns when I have sat with women that they have expressed is they've been really concerned and wondering if they would be able to bond with the baby. And some of the language, they said, well, is it really going to be my baby? And so there's a lot of education and talking about how absolutely that is going to be your baby and you are going to bond. You are going to be providing this wonderful womb in which the baby is going to grow. You're going to be responsible for nourishing that baby and taking care of yourself so that the baby gets everything that it needs. And so it is definitely your baby. And one of the things that was so wonderful about the group is that the women, this one group, the first group that I had, there were 6 women in the group, and they all conceived through ovum donation. At the same time, I had a group of general infertility, and the women in the ovum donation group conceived much more quickly. Within a period of 6 months, they were all pregnant, and one of the members actually had a miscarriage, and it was diagnosed that she had a structural issue with her uterus, and so then she went on to conceive after that and carry twins. So every single one of them did conceive, which is not the statistic for the general infertility group. And in the general infertility group, some of the women took 2 or 3 years to conceive. So it was pretty amazing for me. And what happened in the group, the OFAM group, is that the women got to see um, uh, the the first woman that was pregnant. They got to watch her pregnancy, and then actually what happened is after she gave birth, she brought the baby to the group, and they were able to witness the bonding that was occurring. It was really a great experience for them, but that is one of the concerns. And then of course, what the other thing that I had talked about is issues of disclosure: who to tell, when to tell, and what to tell. And what I've experienced is that everybody really has what is going to work for them. Every family is different. And so that's part of the discussion and the problem solving that we go into when I'm sitting with a couple or an individual. And the first step is really for them to be able to wrap their own mind around the fact that they're going to go through this family building option. So that's really the first step, is that they do the grief process, and then they start getting comfortable with their own story, and then they start deciding who they're going to tell and when they're going to tell. And I've had people that have not disclosed to anybody about the fact that the baby was conceived through ovum donation. They had good reason to. His mother was somebody that had some mental health issues, and they really felt, based on her past history, that what she would say and how she would respond would be destructive to their family. But most people, and what's recommended by those of us in the mental health field, is to disclose and to start disclosing early. Um, when the baby's a baby, start reading these books so that then you can become more comfortable with telling the story, and you get better and better at it as your child grows and ages. So I think what I'm going to do, and then I have more information. I do have a CD and MP3 file on transition to ovum donation. So if you're interested in that, you can access that on my website.